Diagnosis and management of hypertension. Blood pressure. Blood pressure is the force of blood against the walls of arteries. Systolic blood pressure can be measured when the blood is exported by the contraction of the heart. Diastolic blood pressure can be measured when the heart relaxes to import blood. Diagnostic criteria of hypertension. Hypertension is diagnosed when the average systolic pressure is 140 millimeters or higher, or when the average diastolic blood pressure is 90 millimeter mercury or higher, taken on 2 or more separate days. Systolic and diastolic blood pressure of less than 120 millimeter mercury and 80 millimeter mercury respectively is considered normal. Most people who think that their blood pressure is low actually have normal blood pressure. Symptoms of hypertension. Most patients think of a stiff neck, headache, or dizziness as common symptoms of hypertension. However, most patients with hypertension have no symptoms unless their blood pressure is very high. As such, patients are tempted to skip their regular checkups or even their medication because they lack symptoms. However, untreated hypertension with no symptoms can cause stroke, heart failure, myocardial infarction, or even death. This is why hypertension is called a silent killer, because it can end your life suddenly without warning signs. It should be emphasized that most patients have no symptoms. Secondary hypertension caused by pheochromocytoma or Cushing syndrome can be symptomatic. Risk factors of hypertension. Risk factors of hypertension are advanced age, genetic link or family history, obesity or overweight, high salt intake, harmful use of alcohol, tobacco use, physical inactivity, lack of potassium intake, diabetes, and dyslipidemia. If you have any associated conditions such as diabetes, the risk of hypertension is even higher. To prevent hypertension, manage your modifiable risk factors by adopting a healthy lifestyle, like weight control, increasing physical activity, eating less salt, quitting smoking, consuming less alcohol, or managing emotional stress. Importance of blood pressure control, complication prevention. Patients with hypertension often skip their medication or regular checkups because they have no symptoms. If hypertension is neglected, it can lead to more severe diseases or complications such as stroke, myocardial infarction, and chronic kidney disease. Continuous blood pressure control is recommended to prevent these complications. By controlling blood pressure, you cut the risk of stroke by 30%, myocardial infarction by 25%, and chronic kidney diseases by 23%. Blood pressure target. Blood pressure below 140 over 90 millimeter mercury is generally advised to prevent complications. However, blood pressure targets can be adjusted according to age, number and type of risk factors and associated diseases. Therefore, if you have hypertension, you should consult your physician to set a target after evaluating your current health status and risk factors. According to the 8th Joint National Committee or JNC8, those over age 80 are advised that their target blood pressure should be below 150 over 90 millimeter mercury. Target blood pressure should be below 140 over 90 millimeter mercury for hypertension combined with cerebrovascular disease and atherosclerosis. For those under age 80, maintain below 140 over 90 millimeter mercury, and those over age 80, maintain below 150 over 90 millimeter mercury. Managing hypertension. There are two ways to manage hypertension: practicing a healthy lifestyle and taking your medication regularly. The aim of a healthy lifestyle is to control risk factors such as tobacco use, harmful use of alcohol, physical inactivity, and high salt intake. If your blood pressure is very high, then your doctor may recommend that you start taking drugs right away, but you need to continue pursuing a healthy lifestyle. Healthy lifestyles. Managing your diet is very important in controlling hypertension. It includes reducing salt, cholesterol, and unsaturated fat intake and consuming adequate amounts of vegetables and fruit. If a patient with hypertension eats food high in salt, the sodium in the salt increases blood volume, resulting in higher blood pressure. It is very important to reduce salt. Cutting salt intake from the estimated global level of 9 to 12 grams per day to the recommended World Health Organization maximum target of 5 grams per day has demonstrated the potential to reduce the global cardiovascular disease rate by 17% and the global stroke rate by 23%. Physical activity. Physical activity directly reduces blood pressure, but it also has indirect effects through controlling body weight. It also helps to manage emotional stress, which is crucial in hypertension care. However, you need to consult your doctor before initiating any new physical activity as it can transiently increase blood pressure or aggravate existing cardiac problems. Aerobic exercises such as brisk walking are recommended for controlling blood pressure and combined with muscle strengthening exercises is even more beneficial. It is recommended to exercise 5 to 7 times a week and more than 30 minutes each day. WHO recommends more than 150 minutes of moderate intensity physical activity a week, which aligns with the advice of the American College of Sports Medicine. The European Society of Cardiology recommends exercise 5 times weekly for 30 minutes at a time. It has been proven that dividing exercises into bouts of at least 10 minutes is also effective. Quit smoking. Smoking is a risk factor for hypertension. If you are currently a smoker, you are advised to quit. There are numerous toxins in cigarettes which cause cancer, chronic obstructive pulmonary disease, cerebral ischemia, myocardial ischemia, or peripheral arterial diseases. If you are ready to quit smoking, ask your doctor for advice. If you have failed to quit smoking or are highly dependent on nicotine, you can consider starting drug therapy. Quitting smoking can prevent 55% of myocardial ischemia recurrence, which is more effective than preventive drug therapy. Smokers have 2.2 times the risk of death from stroke. Reducing harmful use of alcohol. The recommended limit of alcohol consumption is half of that recommended for people without hypertension. For men, the daily alcohol consumption should be less than 2 glasses of alcohol. For women, consumption should be limited to under 1 glass per day. Men are recommended to limit consumption to less than 2 drinks, that is 20 grams of alcohol, and women less than 1 drink or 10 grams of alcohol per day. Benefits of healthy lifestyles. Controlling high blood pressure involves not only drug therapy but also practicing a healthy lifestyle. Taking medication daily is key to maintaining stable blood pressure in the target range. Healthy lifestyle, including salt intake reduction, physical activity, weight control, lower alcohol consumption, and eating more fruits and vegetables help maintain or decrease blood pressure. It is more effective if these lifestyle factors are controlled together. Smokers can reduce overall cardiovascular disease if they quit smoking. Measuring your blood pressure. Before measuring your blood pressure, try to sit comfortably without drinking coffee, alcohol, or smoking for at least 30 minutes. Caffeine, alcohol, and nicotine can cause adrenaline secretions which raise your blood pressure and pulse rate. Lean back and rest for 5 minutes before measuring your blood pressure. Caffeine and alcohol and nicotine can activate the sympathetic nervous system, causing adrenaline secretion. This causes vascular contraction, higher pulse rate, and increased blood pressure. Drug therapy. Although a healthy lifestyle helps control blood pressure, most patients still need to take medication. The effect of antihypertensive medication is gradual, so it may take time to see results. Combining a healthy diet and physical activity with daily medication is important. Different antihypertensive medications have different side effects, and it is important to know the most common side effects of the medications you are taking. If you think you are experiencing side effects, consult your doctor. Take home message: hypertension is mostly asymptomatic. Hypertension management prevents complications. Healthy lifestyle is crucial in managing high blood pressure. Take your medication as prescribed every day, regularly, and patients should consult their physician before starting or discontinuing medication.